This is a Zoom meeting, not a webinar. And so you can communicate with each other, introduce yourselves, and ask questions. We'll be collecting those questions and then have time for Q&A towards the end. So with that, I wanted to also tell you just a little bit about the Bay Area Global Health Alliance. We have roots here in the Bay Area, and we're a membership organization uniting diverse sectors to foster global health, innovation, and equity. We have more than 85 members that span academia, including and especially Stanford, UCSF, UC Davis, and UC Berkeley. Technology sector, the other private sector partners, startups, foundations, public institutions, and nonprofits and NGOs across the globe. About a third of our members have a tech focus, and about 60% of our members are based outside of the Bay Area. The Alliance serves as a neutral convener, bringing people together like this, and we're recognized as a global digital health leader. We facilitate multi-sector collaborations and have served as the Secretariat of the World Health Organization and Task Force. So with that, we have gathered some amazing colleagues and friends to join us today, each with a slightly different journey. We have Joanna Sickler, Vice President, Health Policy and External Affairs with Roche Diagnostics. We have Neha Agarwal, who is also our vice chair of our board of directors, and she is the co-director of the Global Diagnostic Program at PATH. We have Claudia Marr, who is the Strategic Partnership Development at Google. And we have Sion Brown, who is the Health Equity Innovation Postdoctoral Fellow with Stanford University's Byers Center for Design. And with that, I would just love to hear from each of you, the panelists, about your career journey. And Joanna, may I start with you?
Sure. Thank you so much, Sarah, and it's a pleasure to be here with all of you. And as Sarah said, I would really encourage you to ask questions and put them in the chat, because this time is for you and to provide value for you. So to tell you a little bit about myself, as Sarah mentioned, in my current role, I'm the Vice President of Health Policy and External Affairs at Roche Diagnostics. I think most people have no idea what that means, but to try to sort of encapsulate it very concisely, because I do also want to get into the journey of how I got here. I lead a global team that's responsible for our engagements with supranational organizations like the UN and the WHO, and is responsible for setting the health policy agenda for the entire Roche Diagnostics organization. And to do that, we work in collaboration with our regional partners, and then this rolls down to specific work on national policy that is executed by our country teams. We are a very large organization at Roche. How I got here, I think like many global health careers, is very windy. I started out very interested in health technology and how health technology could solve public health problems. And during my career, I've sort of become even more interested in the implementation of new health technology. And that's really come from seeing how the greatest thing can be developed, but if it's not implemented correctly, it's never going to realize its promise. And so on that journey, post grad school at Berkeley, I think we have some Berkeley people on here, where I got my MBA and my Master's of Public Health. I spent a few years at Gilead Sciences in marketing, and that was mainly with a US focus. I sort of came to a point where I recognized I really wanted to work in global health, and that like it was sort of now or never. I was like single, in my 20s, I could move. And so I ended up being very fortunate after a lot of effort. This did not happen overnight. It took a year, getting a role with the Clinton Health Access Initiative based in India to help manage their partnerships with generic pharmaceutical manufacturers. And that was really my transition to working in global health. I stayed with them for several years, working in many different capacities, including doing a lot of policy work in Geneva related to how we enable access for low volume therapeutics, because at the time, a lot of the work Chai was doing was focused on pooling volumes to bring down prices. But what do you do if the volumes are not high? And that sort of became what I was focused on within the organization. I was fortunate enough to be recruited to join a startup. It was a private company solely supported by the Gates Foundation, so not really, that was focused on global health and specifically developing point of care diagnostics. There, being a startup, there were, I think, 25 people when I joined. I wore many hats. I technically had a commercial title, but I also did medical affairs, as well as policy. And unfortunately, that company went bankrupt, which is sometimes a really sad and not uncommon story in global health. And so after that, I was fortunate enough it was actually a complete series of happenstance. The company I was at had gone bankrupt. It was very immediate. I wanted to take a couple months off and go into consulting. I was connected through a friend, Roche Diagnostics. They recently made an acquisition of a point of care technology I was very interested in. Ended up joining them as a consultant, and then 9 months later, taking a position in medical affairs. So focusing on the medical side of things. I did that for 6 years and not in a global health capacity. So the product I worked on was actually only for high income markets. And that is one thing I would highlight too. I think the ability to have a skill set where you can pivot, because sometimes global health jobs are few and far between. Then 3 years ago, Roche Diagnostics reorganized and formed the health policy team for the first time. It was a new capability that did not exist before. And I was fortunate enough to be chosen to lead that role. So that's how I am here today. My team focuses on both high income and low and middle income countries. We have 2 global health specialists on the team that focus on low and middle income countries. And that sort of, I'm always very comfortable leaning into that side of it. But in my current role, I do cover the entire globe related to policy. I think I maybe went a minute over. So hopefully that was a good summary. Thank you very much.
Joanna, thanks so much. That was really interesting to hear your journey. And with that, I'll turn over to Neha. And with Neha, she's the one I was mentioning, kind of went from engineer to NGO and also worked at Chai. So with that, Neha, could you tell us a little bit about your story and your path?
Yeah, sure. Thanks, Sarah. And Joanna, thanks so much for sharing yours. I think there's a lot of parallels, which, I'm hoping we can get into with the discussion. And apologies, I am getting over a bit of a cold. So apologies if my voice is a bit crackly this morning. But I think, part of my journey stems from the fact that I'm a Bay Area baby. I was born and raised in the Bay Area. And I think similar to Joanna, I thought I was going to solve the world's problems through technology and innovation. And I think that there's certainly a lot of room for that. And we're seeing yet another sort of boom in the way that technology is reshaping our lives. But through my career arc, I think similar to many of the panelists, I also found the need for blending various different disciplines to be able to really achieve impact, particularly in sectors that are challenging like global health and development. So just, by way of background, my technical training is in biomedical engineering, and I'm also a Cal alum, so go Bears. And, in that technical training, a lot of the interest that I had was basically the folks that I got to network with. And we all sort of really ignited our interest in technology and innovation. And I had the pleasure of working with a handful of startups in the Bay Area doing really cutting edge things. And so, again, similar to Joanna, really having sort of that line of sight in terms of how do you take a cutting edge technology and make it mainstream? What are the bottlenecks and barriers that you have in being able to do that? And then you start entering this world of policy and decision making and governance, and you realize that the technology is just the very first step of a broader ecosystem. And for me, it was also quite challenging to sort of break into the sphere of global health. And my pathway into global health ended up being through consulting. And I was lucky enough to join a consulting firm that had a very large contract with the Bill and Melinda Gates Foundation. And they needed somebody with my analytical engineering skills to sort of build models to assess the cost effectiveness and health impact of the global health portfolio sitting under the Gates Foundation at the time. And so it was such a privileged opportunity to be able to have visibility into one of the largest global health donors. And from that, I sort of gained the credibility to enter into the global health space, and was recruited by CHI to lead their TB access portfolio. And from there, I went to PATH, which is where I am currently. And so, as Sarah mentioned, my role is to co-lead our Diagnostics Global program. And it's, to me, I think, a very interesting and rewarding role because it blends a bit of my technical background, a bit of my access and commercialization background into a very end-to-end program where we do R&D and innovation. We have a BSL-2 lab in our HQ in Seattle, all the way to policy and regulatory, and working hand in hand with our 20 plus country offices to ensure that innovations are not just sitting on the shelf, but actually getting adopted when and where appropriate, and with sort of taking the lead of ministries of health in terms of meeting their needs rather than, pushing technology for technology's sake. So I'm sure we'll get into some of the finer details there, but I think I'll stop there in terms of my background.
Thank you so much, Neha. That was great. And kind of going from one engineer and tech solution and career, I'd like to move on to Claudia. And if you could tell us a little bit about your journey.
Absolutely. Yeah. Thank you so much, everyone. Real privileged to be here and to get to hear from other folks' paths. Interestingly, for me, technology was not the starting point. I'm not a Bay Area native. So I started from the complete other end of the coast as a Canadian, and actually started my career as a nurse. So very kind of rooted in my belief of just helping people in a very kind of tactical way, and did that for a few years on traditional kind of medical unit. And I think, like many frontline clinicians, I felt this stronger desire to address some of the gaps that I was seeing on on a day-to-day level. And actually that led me to pursue higher education. I ended up pursuing a master's in public health and in health administration, and then took on a number of different care transformation roles, both within health systems and then eventually within our federal government in Canada, where I would work with different levels of leadership at the provider level, patient advocates, identifying gaps in care, putting in place improvement methods, and then really evaluating the impact on what we call the triple aim and now the quadruple aim of, do the changes actually yield the intended consequences or benefits in terms of better experience, better quality of care, and lower cost. And then, of course, what is the experience for clinicians? And that, to me, was a real tangible way of actually having a broader impact in a way that I wasn't able to as an individual clinician. And it was very kind of fulfilling. And it was also a way for me to expand the scope of influence from, serving a few hundred patients to, thousands and eventually tens of thousands, working at the national level for an organization called the Canadian Foundation for Healthcare Improvement, which was funded by the government of Canada. And eventually, for personal reasons, I ended up moving to California, ended up taking a role at Stanford, where I did very similar work, but in the US context. So it was actually taking very practical research findings on evidence-based practices in terms of what works best for primary care, for oncology care, and then really working in a consulting capacity with health plans, with providers, and advising them on what methods they should be taking to implement those best practices within their local settings, and then similarly trying to evaluate the outcomes within their respective environments to see if it yielded the same impact. And around that time, I became a patient in the US system for the first time, which was very interesting and eye-opening coming from a Canadian perspective. And so was, kind of had to go through, surprise bills and prior authorizations. And for me, that became kind of that pivot to wanting to experience what a better healthcare experience could entail, and as a member, and ended up going to a healthcare technology company called Collective Health, and ended up leading our ecosystem of payer partnerships. I was our director of partnerships and strategy there for a few years, and the goal of the organization was really to help administer benefits for large self-insured employers who really wanted to enable an optimal experience for the lives of their employees. And that was really a fascinating experience that actually ended up being the kind of the entry point into Google, where I joined about 4 years ago to lead both our go-to-market strategy for a clinical enterprise product to help streamline, the way that clinicians actually make decisions about their patients on a day-to-day basis, and really kind of helping to implement those solutions within large provider systems, which was something that was very familiar to me as a frontline clinician. And then most recently, I've pivoted into a role on the search team where I lead our health partnerships. And there you'll be familiar with that when you open up a phone or a computer and see a search bar and you type in a question related to your health, whether it's about symptoms or conditions, drugs or treatments. We see hundreds of millions of those queries every day. And my role is really to work with our cross-functional stakeholders in product, engineering, clinical, et cetera, to really think about how we bring in the most authoritative health information to the surface so that we can ensure that the average person, whether that's a physician, your grandmother, yourself, have access to high quality information to guide your health journey. So for me, it's always been that kind of balance of trying to expand the scope of impact and really help people in their health journeys. So I'll leave it at that and turn it over back to you, Sarah.
Thank you, Claudia. What an interesting journey, from clinician to patient and having that motivation of kind of being on both sides and wanting to improve that. Thanks so much. I'm going to turn to another medical clinician and to Cyan. And Cyan, if you can kind of tell about your journey and what that's been like, and you're still on your journey as we all are, and you're kind of newer. And so I hope that you'll be able to not only talk about your journey, but be inspiration to many of the students on the call today. Over to you.
Thanks, Sarah. Good morning, everyone, and thank you to the Bay Area Global Health Alliance for hosting this. I'm really thrilled to be here. So, as Sarah said, I trained as a physician in South Africa. I'm originally from South Africa, and unlike here in the US, we go directly to medical school once we leave university. This for me felt like the only decision really in terms of what I was going to study, and really enjoyed medicine, and particularly learning in the healthcare system I did. It was immensely challenging given our quadruple burden of disease and a healthcare system which doesn't always have the resources it needs for the population it serves. So I felt like I really learned a lot and enjoyed the clinical side of it. But from the get-go, I was always really intrigued by how do we solve things at a system level? What does it take to prevent these people that I am seeing in the hospital get here in the first place for things that are preventable? And I didn't quite have the language for that in my first and second year, but was given a wonderful opportunity to do an internship at John Snow International, which is a public health consulting firm in Washington, D.C. in my third year through a leadership program I was doing. And this opened my eyes to the world of public health. And I was suddenly able to language a lot of what I had been thinking and feeling. And after finishing my medical training, it just felt at an intuitive level the next right step to study my master's in public health. So I did that through King's College London in the UK. And throughout my studies, I really enjoyed and benefited from suddenly having a much higher system level view of what I was seeing in the hospital. So understanding a lot more about biostatistics, understanding about health economics, understanding the trends, and being able to contextualize a lot of my experiences. During my studies, I came across a statistic which had just really sat with me. The Lancet Commission published a report on global surgery. And I mean, we read a ton of papers during master's coursework and read a lot of stats, but this stat in particular, that 5 billion people in the world globally lacked access to safe surgery, and there's criteria what it means to be safe, but briefly, access to good anesthesia, a surgeon and proper equipment. And this became such a focus for me. I did my thesis on looking at how we can use frugal, meaning low cost, but quality innovations to improve surgical care in low and middle income countries. And alongside that was actually doing a innovation program where I built my first low cost device to basically ensure that clinicians leaving the hospital were able to sterilize their equipment in a safe and environmentally friendly way. And this was aimed at preventing antibiotic resistant infections in the hospital. So I realized I wanted to become more of a doer based on those experiences, and landed at Stanford Center for Biodesign. For those of you who are unfamiliar with what biodesign is, it's basically a design thinking method which you learn as a way to produce health innovations in a really systematic, de-risked way. So we work on multidisciplinary teams with doctors, engineers, all sorts of people. And during the 10-month fellowship, our team worked on VP shunts for children with hydrocephalus, a condition where there's too much fluid in the brain, because these shunts very often block. And so we were developing technology to help ensure that they block less frequently. I have stayed on in a role that I really enjoy now, where doing research and helping rework some of the content to help innovators think more critically about access, because innovations always impact access, and initially not necessarily always for the better. It takes really thoughtful design and just a lot of awareness about who it's affecting, who it's not reaching, who's able to pay, who's not able to pay, and what are the types of innovations that we're encouraging our fellows and students to create, because sometimes you can only solve problems that you can see. And so for the problems that are not immediately visible, how are we going after them? So that's a lot of what I do now. Alongside my sort of academic journey, I've always been hugely involved in leadership. I ran a Women in Leadership Academy for 10 years over the course of all my studies and beyond that, which looked at helping young South African women gain life, business, and leadership skills, because I just saw the critical need for enabling an environment where young women were able to thrive, particularly in my context in South Africa, as an essential determinant of health, actually. And thereafter was an Atlantic Fellow for Health Equity, which is a non-residential fellowship program, which were a collection of about 800 people globally, multidisciplinary, very much focused on building networks and collaborations to solve issues of equity, not just in health, social and economic equity, and have just stepped off my board position there and have really enjoyed being part of different communities alongside my academic career that helped me think about equity and leadership, and really working with different types of people to achieve the goal of innovations that can hopefully have impact where they are most needed.
Wonderful. Thank you so much for that. And I really appreciated you mentioning the global surgery movement. My career has been really moving from cause to cause in global health, most recently looking at advocacy and policy with global surgery. And in fact, that's even how I met Abby, our deputy director in that movement long ago. So it was nice to hear that. It was also nice to hear all of you talking so much about how you are more focused on the whole ecosystem and what a multidisciplinary and multi-sector approach is needed. And that's very much at the heart of the Bay Area Global Health Alliance, because our theory of change is really about, we believe that you have to have collaboration across the sectors and expertise and geographies to really solve the problems that are in front of us. With that, let me ask you just, we do want all of you to put more questions in the chat, but I wanted to kick it off by asking a few questions. And let me start by asking Joanna, what's the best advice you received early in your career?
Best advice I received early in my career was, I think, advice that pertains more to being female, having an interest in global health. And that advice was, no matter how unfairly you are being treated in your work environment, you show up every day and you do the best job you can, while in the background, you find a better situation so that when you leave, they're really sorry. And I think that was very good advice.
That sounds great. Neha, let me ask you, yeah, I just love that. And Neha, I know that your journey has been very windy. And what was the most surprising part of your career journey?
I think the most surprising part, and I continue to be surprised by this, is almost understanding through external validation what you're bringing to the table. Because as you move from sector to sector, you're learning things and you're sort of fitting into an environment where you're working along the same assumptions, you're working towards the same goals, and all of a sudden you move into a different sector that works fundamentally very differently. And what you realize is that you've learned things, you've learned to manage things and do things in a way. Sometimes it's in conflict within the new environments that you're going in. Sometimes it's tremendously helpful. And it takes a while for you to realize that that is a skill that you're bringing to the table. And so I think as, many of us jump from one industry or one sector to another, really carrying that, positive impact with you, and knowing that even though things might be done slightly differently, it's really beneficial to voice your opinion or even provide perspective on how things could be done differently. So one thing I've been now at Path for a very long time for me, which is 8 years. And I'm always looking for fresh perspectives. And so when we have a new recruit, I am bugging them every day about how they used to do things at their old job. And so it's, as you're navigating your career and you're entering new jobs, new sectors, use that to your advantage, because I think people who've been in the global health space for a long time could really benefit from some fresh perspective.
Thanks, Neha. That's great. And then, Claudia, could I ask you, what do you know now that you wish you would have known early in your career?
I feel like that answer can change on a day-to-day basis, but I think it's this concept that careers are not a linear progression. As we've talked about, but it is. We use the word windy. I would use the word zigzag. My career has been fairly atypical when I look back, and I would expect it to continue on in that way into the future. And I think when I was earlier in my career, I put a lot of pressure on myself to make that next decision. It felt very consequential and deterministic. And I think a lot of us probably are in similar categories. And I've come to believe that you can only, make decisions based on the information that you have at that particular point in time. And then that will be the right thing at that, at that life juncture. And to Neha's point, there are valuable aspects of whatever role you'll take on that you can carry forward into your next role, and that you should see that as a strength. And for a long time, I think I was sort of doubting that, how is being a nurse going to help me progress to the next phase of my career, or is that going to be a hindrance? And I think over time, I've kind of learned to craft that narrative. And so I think just going into it with the notion that, there are building blocks that you're just assembling, and that's a richness that adds to your, your narrative and your experiences and set of skills. is something that you should embrace.
Thank you, Claudia. I'm glad you said that, because I never would have thought working on Capitol Hill and in American democratic politics would get me to where I am now. But there's something, this skill set, it's kind of a common thread of in my career has been building partnerships and building connections and collaborations, and here we are. With that, I'd love to turn kind of move. We've got a lot of great questions in the chat right now, and I'd like to kick off the discussion by asking Zoe from the Stanford Medical Students Group to please ask the first question. And so Zoe, please go ahead.
Yeah, so I guess ask the question about being a clinician and wanting to return to work in a broader aspect of healthcare. So if any of you would have advice for how clinicians can create a career in the field of global health.
And then Cian, do you want to, Cian, do you want to answer that first?
Sure. Thanks, Sarah. Thanks, Zoe. So I think I want to start by framing that global health is not foreign health. To do global health, we don't need to be elsewhere in a different country necessarily. And I know this is primarily a US audience. And so I just want to start by framing that there are so many care gaps here in the US and so many populations which don't have the care that perhaps is possible on the coasts of our country. And so it doesn't necessarily require going elsewhere to do global health work. I think so. There's two different sort of questions with what Zoe asked and in the chat, just in terms of starting off in global health versus re-entering. I think if you're starting off, I would recommend that you think about broadening what you read as a start. You know, I think the imperative skills in global health and the best way to think about how to be useful to communities that really need us may require a very different skill set to what you're learning academically. You know, books on development, pedagogy of the oppressed, really good books that maybe give you different perspectives is a great way. The second way is to get exposure to different types of communities. And for some programs, in terms of actual clinical programs, there are fellowships or exchange opportunities. I want to caution and caveat, as a South African who routinely had clinicians from abroad come do quote unquote global health experience in our hospitals, it's a lot of work to train people to be adept at a completely different burden of disease, you know, but just to understand our work style, which may be different from what they're used to, and then in 6 weeks they're gone. And so whilst it is a really useful exercise for learning about different healthcare systems and settings, I'd encourage you to think about how to make that reciprocal, and B, how if you are going to get exposure to different types of communities, whether that's locally or somewhere else, what can you do to plug the gap that they need and not necessarily do what you've always done in your setting. So if you're a first year resident, you may need to go there and do something else because that's what they need. But I do think it is important to expose ourselves to different types of healthcare systems and settings. And I'll just finish by answering the question about getting back into the field as a clinician with a broadened perspective. Again, I don't think you need to necessarily leave or go elsewhere. I think with the advent of telemedicine, there is a lot of opportunities to think about reaching people that previously never had access. And it depends whether you wanted to now travel and be in a different community or whether you wanted to stay where you are. But I really think for me, the global health and medicine is a lens that we put together about how are we bringing together our clinical skill sets to help those that are most in need. And there's a lot of creative and wonderful ways to do that, both clinically and non. And I think it's really about where you are situated in your life in terms of your willingness to travel, what type of work you want to do. But I don't think it requires a massive jump. I think it requires a different lens, perhaps, and thinking more creatively about reaching populations.
Thank you so much. That was great. And kind of following along those lines, we've had many questions kind of on what skill sets are required. So we had Kiana and Joy and Eva. Thank you so much for your question. So what steps, and I'll just throw it out to all panelists, but steps in your early career that were critical towards developing the skills that you needed to be successful, and what have been the skills that have been most useful, and what are the skills that you wish you would have learned earlier in the career or that you feel like you still need to learn. So with that, I'll just turn it over to the panelists. Neha, Joanna, Claudia, any of you want to jump in here?
I can kick us off. So I think for me, because I've always worked in health, but I've worked in very different sectors and also in very different functions. So I've worked in policy roles, I've worked in medical roles, I've worked in access roles, and I've worked in business roles. And for me, the core skill set that has really been most valuable is analytic driven strategic decision making. And looking at data and making strategic decisions is critical in every function. Working in a private company, something I actually hear a lot is that strategy is what business does, and I think that's absurd. Every function has strategy. Regulatory has a ton of strategy. Your regulatory team isn't strategic, you're going to have some very serious problems. And so I think developing that skill set was super helpful, which I really do attribute to my MBA training. That was really helpful for me to get that skill set. But I then had to apply that in a very different context. And I think that goes back to some of the things that Neha was talking about earlier about being humble and listening and learning. You don't know everything, and that's okay. And I think sometimes, particularly when people feel insecure, they default to sort of, I know what I'm doing. And I think that that's the worst attitude possible that you can have. I think being really grounded in, this is what I'm good at, this is what I bring to the table, and there's a set of things that I really need to learn how to do. And I always tell, because I do bring a lot of people, most of the people on my team were hired externally. And something I always tell them is your first 6 months, you're not supposed to know what's going on. So take advantage of that. Ask as many dumb questions as you want, because if you don't ask those questions a year and a half from now, you're still not going to know. And then it's not acceptable anymore that you don't know.
Really, really good advice. Does somebody else want to jump in? Claudia?
Oh yeah, I would definitely echo the question side of things. So and I think about I know there are a lot of clinicians in the making or active clinicians on the call, and so when I think back of some of the early kind of skill sets that I developed and I still kind of try to leverage in my day to day that have kind of been useful in any role and capacity, it's really those soft skills that I try to continue to cultivate and also look out for in other people that I work with. And early on, it was really like ask as many questions as possible, just be intellectually curious. Even if you think you know the answer, but you're not sure, ask the question. And especially in those kind of early phases of your role, but even as you take on a new situation or new work context, I think that's really critical. And the other aspect I would say is around just communication. There's this like really great Maya Angelou quote that I'm going to butcher, but it's something along the lines of like, people may not remember what you said or what you did, but they'll remember, how you made them feel. And I think ultimately it's really just about kind of that interaction, that kind of having that emotional intelligence, like how you show up for people, how you're quickly able to build rapport and trust. And a lot of that is really kind of foundational to being a clinician and like just showing up in a patient's room and like interacting with them. And you can imagine that translates really well into a global health role, whatever that might be. In my case, it's strategic partnerships, but in Joanna's role, I'm sure that's also very critical, and Neha's role as well. And so I think just being able to communicate with people as humans on a relational level is really important. And I think so just keeping in mind that those skills that you're developing today will carry through in other aspects of your career.
Thank you so much. That's really great and such good advice. And it's certainly been true in my own career of just showing up for people and having what we had called over at the D school, a beginner's mindset. So at being curious all the time, but also just putting on that beginner's hat, whether you think you know or not. it can be quite interesting and can put you in a place of understanding, what the patient needs and what the problems are. So thank you all very much. I'm going to also, we have a question on mentorship from Savannah. Can you all speak to seeking mentorship along the career journey with such variations in public health paths and expertise? She's found it challenging to find mentorship that really speaks to all the different career pivots and interests. So with that, Neha or Ojana or Cyan, do one of you want to answer that? Claudia,
Yeah,
feel
I'm happy
free
to.
Yeah.
I'm happy to take a stab at that one. I think mentorship is so critical. And just building off of the last question, we all approach global health in many ways. In my journey, now being with sort of the NGO sector for a while, there's not a lot of formal training that is offered to sort of build specific skill sets just based on we work in a soft money environment. We're always trying to be very scrappy and make the donor dollar go a long way. And so it's just not, unfortunately, an infrastructure that NGOs are typically known for. And so what that ends up doing is putting a lot of the onus on the individual to figure out how they're going to grow their career. And so I think two things. One is, I think the relationship between you and your manager is so important. And I think we have more agency in deciding that than we give ourselves credit for. So if it's really important for you to establish a relationship with your manager where you can actually take some risks and really put yourself into situations where you're growing and learning, but it's okay to fail, because if you're not failing every once in a while, you're probably not pushing yourself enough. And so I think having that relationship is really critical, and then supplementing that with really strong mentorship. I think most of my life, I feel like I've had maybe one mentor. And what I'm realizing is that you actually need a panel of mentors to be able to push and pull you in different directions. I think one person talked about build a board of directors for yourself, and I really love that. So, and you also have to be really intentional about who you are regarding as a mentor, because I think it's very easy for mentors to somehow provide advice that directly benefited them or that directly relates to the career path they took, because they know it best. That's where they can provide a lot of advice. And so balance that out and sort of leave some wiggle room in terms of the various directions that you are interested in. And I know it's scary to ask for mentorship, but I think many people are really willing to offer it. And so I would say take that risk and ask somebody if they are somebody who's interesting to you, you admire their career, you admire some of the risks that they've taken, chances are they would actually be very excited and very honored to serve as your mentor.
Thanks so much. Really, really wise advice. Would one of our other panelists like to follow up on mentorship? Has there been a mentor who's meant a lot to you?
Yeah, I'm happy to. So first, I just really want to reinforce what Neha said about the board of directors. And I think that speaks directly to the question about the idea of finding like one perfect mentor who's going to be able to exactly address your career path. That doesn't exist. I think that you need to have different people for different things. I am somebody who has had almost 2 decades relationship with a mentor. And my mentor is now actually retired, which is really interesting. And that said, he's the one who gave me the advice I shared earlier, related to always doing a good job, even when things are not fair. And he's somebody who's really been there for me and really helped me in some tough spots. He's also given me some really bad advice sometimes. Like, for example, at one point he suggested I look at this great new company called Theranos. That was bad advice. So I think we all need to recognize that there is no God of careers, right? And that's where I think having relationship with lots of different people, getting lots of different information, and also recognizing that it doesn't like some relationships can develop very organically, right? So you don't have to go to someone and say, will you be my mentor, right? If there's somebody who you look up to, who you're interested in, asking for a little 30 minutes of their time and like starting a dialogue, and that can then grow. So I think that's also a really important way to think about this, because I have people in public sector, private sector, who I'll reach out to at different times, depending on, what the issue is or what the challenges I'm facing.
Great. Thanks so much. I wish I would have had this conversation when I was early in my career. So much good advice. We have another kind of related question on networking from Joy. And she asked, can you give a specific example of a networking interaction translated into something tangible for your career? And any lessons learned from that? So anyone want to jump in?
I can jump in actually. When I was trying to in the process of moving from Canada to the US, which was no small feat, I was exploring opportunities in the US, and it was a very kind of stressful, anxiety provoking process, like the move itself, but then having to kind of redefine what success in career looked like. And there was because I was doing a lot of work at the kind of federal government level in Canada, that intersected with an organization called the Institute for Healthcare Improvement based in Boston, which was another healthcare improvement organization. There were a lot of sort of, informal opportunities that emerged there. And one of my, acquaintances happened to be doing a fellowship at Stanford, actually. And it was sort of kind of throwing 1,000, arrows and seeing what kind of stuck. And in one of those cases, after having a number of different conversations, he informed me that he was moving on to a different role and put me in touch with the leadership at the Stanford Research Center. And that is actually what enabled me to get connected to that team, and I ended up getting that role. And so, that could have obviously ended up in a totally different direction. You often can network, and it feels like it's not necessarily, leading to the intended path. But I do think that, when you're looking for a particular opportunity, it can take a village. And sometimes you just need to put in the work, and you never know at what particular point it's going to lead to something tangible. But it's important to kind of put in that work, because it's really just a question of timing sometimes. And so in this particular instance, that was a very tangible outcome that, ultimately led me to enable this move, which I'm very grateful for.
That's great. Wonderful. Yeah, I'm just thinking about my own career, and it's interesting. Some things have actually, job opportunities have almost been accidents, but they really led to an amazing career that I'm very thankful for. We also have several questions about advanced degrees, about pursuing a master's degree, or even going off for your PhD or Doctor of Philosophy. And so with that, how imperative is it to getting a master's and MHC, MPH, MBA, or something else when wanting leadership roles in small or large systems? So could one of you talk to that?
I'm happy to speak to that as somebody who's currently enrolled in a doctorate program. I'm gonna give some straight talk here. That's my opinion, and I welcome my fellow panelists to disagree with me. I do think the health sector in general is very obsessed with doctors. I think being a clinical doctor is the top. And then if you're not an MD, then being a doctorate of public health or a PhD is valuable. And when you look at the leaderships of most organizations, they are generally a doctor of some kind. I do not think that this is actually something that's required to have those jobs. I think it's just something about our sector. So my personal opinion is that I do think being doctor can be helpful. I also think you can be very successful without it.
Anyone else want to answer that question?
I'll say for my MPH that it really helped change the way I think fundamentally about just a system level lens. And so it was really useful in tying a lot of things together and giving me new knowledge that pushed me in a different trajectory. Um, I don't think I'm the best person to answer whether it would open doors or not, but I will say that what I've encountered, particularly when working alongside a lot of NGOs in South Africa, is we had a lot of people with public health, global health degrees in those spaces. And sometimes I had wished that we had more people with very specific technical skills. So you don't necessarily need to have studied public health or global health to be doing that work. But you can bring a technical skill of any kind, you know, and with appropriate, necessarily informal training, be able to still do that work. And so if it's going to put you in debt and it's not what makes most sense, I don't necessarily think it's 100% needed either. I'd agree with Joanna.
Well, thank you so much. That's great. Neha, do you want to answer that? And then I'll move into one final rapid round.
Yeah, I was going to say, you know, it's a really hard question to answer. And I think going back to the why you need multiple mentors, because those who have doctorate degrees are much more likely to advise to you to get a doctorate, because in some way or another, it has probably helped them in their career, right? Is it needed? I don't think so. I think there's multiple examples of really strong leaders who don't have a doctorate. And so I think this is one of those things where you really have to trust your gut, and you have to really trust what is the training going to give you, and is how do you learn, and is that technical training the way that you're going to advance? But if it's miserable and you're just putting in the time because you think it's going to be helpful, I mean, I would maybe question that as well. So talk to multiple people about this, because this is a very hard one. I struggled with it. I got a lot of advice I had a master's in engineering, got a lot of advice to stick with that and pursue a PhD. I eventually decided not to. Do I regret it? No, but I also wonder, oh, what would it be like if I had it? So it's not easy, and it's a complicated decision. So just wanted to acknowledge that it's not easy.
Well, thank you very much. And with that, I just wanted to have we have just a couple more minutes. And with that, I just wanted to ask each of you very rapidly, if you have one piece of advice for our audience today, what would it be in rapid fire? And Claudia, can I start with you?
Ooh, I think for me, it would be just make sure to, it sounds cliche, but follow your heart and your mind, you know, as you're making decisions. And I think it speaks to this, you know, there are times where you're going to want to make rational decisions because you get advice externally or you're kind of pushed in a certain direction, but just make sure that it feels right for you in the moment. And again, you can only make decisions with the information you have at hand, and make sure those two things are connected at all times. And if you feel like there's tension, then question why there's tension.
Great, thank you. Joanna?
Not going to get the job if you don't apply for it. I can't tell you how many times I see women not apply for roles because they don't have every single thing listed in terms of the prereqs. If you believe you can do a job and you want to do a job, you apply and you pitch yourself.
That's amazing. Cyan?
I'd encourage people to focus on your career, but also focus on enriching your life, things that are meaningful outside of your career. And for me, I think a lot of the things that have inadvertently added the most value and skill set to what I'm doing now is not things that I got in my academic training. It's things that I did outside of work, and you know, some of the communities and initiatives that we're a part of that have been really meaningful. And so whilst there's a lot of pressure, particularly for those of you still at university and in that stage, make sure to build a beautiful life alongside your career.
Oh, that's wonderful and really resonates with me. And Neha, for the last word before I close us out.
Yeah, I think most careers are really long, maybe longer than we'd like. So be patient, be open to the windiness, and most importantly, enjoy what you're doing, and also balance it out with everything Cyan just said.
Wonderful. Well, you all have been amazing. Thank you so much. And, I'm fairly advanced in my career and I've learned some really nice things. And I think that's part of the journey, is that we're continuing learning. It's what makes life fun. So I wanted to thank all of the audience for coming. If you're a student at Stanford, UCSF, UC Davis, or UC Berkeley, are working at one of our member organizations, we hope that you will join us at our annual meeting, which is coming up on the 21st, so next Tuesday morning. And I just put in information about it in the chat, so you can have it there. And then if you want to learn more about the Bay Area Global Health Alliance, please let us know. We're happy to share further information. We talk about an opportunity to meet mentors and networking. I think our alliance, kind of being very multi-sector and very diverse, it would be really helpful to you all. At least I certainly hope it would be. And so with that, I just wanted to thank Stanford for co-hosting this with us, Zoe for getting so many medical students here, and to all of you, just thank you so much and enjoy your day. Thank you.